Hello and welcome to yet another episode of Hair Talks by Terra Medical. My name is Dr. Joshua Chong, and today we'll be touching on a topic that's frequently asked. What are the results that you're going to expect from a hair transplant, and how long are you going to take to achieve these results? In other words, the whole timeline of your hair growth journey. So let's dive right into it. What happens right after the hair transplant is that you will have a period of healing of about 1 week where there is a social and physical downtime. It's important to have realistic expectations about this. Treat it like a real surgery. After all, that's what a hair transplant is. You're going to have to rest at home, take good care of the grafts to ensure maximal survival rate. Between weeks 2 to 4, there will be a phase where these hair follicles that have just been transplanted into your scalp, where they go into a resting phase. And they might grow for a little bit, maybe a centimeter or two, and then start to have a change of angle and direction, and then start to fall out. That's called the shedding phase. That usually occurs at about the 4-week mark. There's nothing to worry about. It's part of the normal process. So at the point where we first review our patients at the 1-month mark, it's going to look pretty disappointing, quite abysmal. Most of the grafts that have been transplanted would have already entered the shedding phase, and what you revert to is your original state of hair pre-transplant. Lots of patients get really worried whether or not the grafts will actually grow. And what's even more worrying is that this phase of resting hair follicles, we call it the telogen or resting phase, will last for about 10 weeks to 3 months before they actually start to re-enter the anagen or growth phase. Now, it's really important at this point to take good care of the areas that were transplanted into. They are, after all, your very precious hair follicles from the donor area. It's important to keep it clean. It's important to take the medications prescribed to you for that period. It's important to also make sure that you know where the existing hairline is and not put sunblock or other artificial chemicals into that area. And towards the end of these 10 weeks painful wait, I'm sure, you'll start seeing little sprouts of hair emerging from the planned hairline. And that's about time where we bring our patients back into clinic to have the 4th month review. Now we have 4 months post-hair transplant, and you're going to see an increase in the amount of hairs that are starting to sprout. Why this happens is because the hair cycle does take time. So once the hairs have shed, it takes a little while before they start to re-emerge into some tangible length in order for you to visualize it. We certainly can see it on a microscope, but that's not our aim. We want to give you a visible head of hair. That being said, at 4 months, you're just going to see where the position of that new hairline is. You're not going to see a lot of density, but you certainly see an increase in density from when you first started. Fast forwarding to the 6-month mark. Now, at 6 months to 9 months is where the action really picks up. A lot more of those hair follicles are going to enter that anagen phase. You're going to see the double hair follicles emerging, triple hair follicles emerging, and this creates density. So as you come in for your 6-month, 8-month, 9-month review, whenever we arrange that for you, you're going to start seeing that when we take photos and put those photos side by side, there's going to be better coverage of the scalp. There's going to be a higher density. The hairline is going to look a lot more defined. Maybe not quite so natural yet, but you're going to just see things progress, and you're going to really start to appreciate the effects of a hair transplant. Now we are at the anniversary of the hair transplant, the 1-year mark. Most textbooks will tell you this is the pinnacle of the effects, but we'll touch on that later. At 1 year, we usually bring our patients back for another set of photos, and we want to compare how much more growth there's been between 8 months and 1 year. Usually there's another 20% increase in density overall. We also want to see whether or not the patient has entered this phase called cycling. Now, cycling is quite unique to hair transplant in that transplanted hair follicles between the 10th month mark and the 13th month mark may enter a bit of shedding. Between 9 months and 12 months, some patients do expect a little bit of decrease in density. It should be subtle, but the hair transplant physician should observe for this. Why this happens is because as the first cycle happened, and now there's going to be a phase where they want to recycle and drop and regrow, you'll see actually some of the initial harshly grown hairs fall off. However, at this point, you should see quite good coverage of the scalp. It should be approaching maximum density, and most patients will tell us they're really happy with the results at this point of time. Our next review would be at 18 months, so 6 months since we last saw you, and at this point, cycling would have completed. We talked about cycling before, and we talked about those harsh hairs falling off your scalp. What those harsh hairs then become when they regrow again is softer, more smooth, they're more natural, and they fit into a hairline transplant much more aesthetically. At the 18-month mark, we're going to be showing you pre-op photos and the 18-month mark photos and show you how much of a natural hairline you've managed to achieve. It's at this point that I want to remind everybody that not everybody's hair transplant journey will be the same. Some patients will experience different milestones in their hair transplant journey from others. There'll be people who experience almost no shedding, that's quite rare. There'll be people who experience faster or sometimes slower growth than the usual. Sometimes this is also affected by certain events along the way that might have happened during your healing or recovering or regrowth process, such as weight loss, starting a new medication, having a telogen effluvium episode, and in this context we're talking about COVID shedding, that might set us back a few paces. Ultimately, what you should see after all the regrowth has happened is that desired effect of nice, dense hair. And that's all for today, it's a wrap. Now, if you've gone through a hair transplant and you find that your results or your timeline doesn't quite match what I've described in this video today, feel free to drop us your questions in the comment section below. And if you've liked this video, give us a thumbs up and remember to click subscribe to get more hair related content. I'll see you next time.